As America reopens for business, what should we expect to see? I'm Scott Ott with Bill Whittle now. And Bill, we are going back, especially here in Texas, to not business as usual, but to a phased reentry process. The store where I work full time will be opening again this coming Monday, the 4th of May, on a limited schedule with a limited staff and a limited customer capacity allowed under the governor's orders. You've been so deeply immersed in all of this, having done some 26 episodes of the Coronasphere Lounge, and we've done a total of, I think, at last count, about 64 shows related to this pandemic in one way or the other at BillWhittle.com, thanks to our members who support us there. And Bill, as you look forward now, so much of what we've been doing is diagnosing day by day what's going on and trying to figure it out. As you look forward now, there are a couple of questions I have regarding what you're looking for. First of all, the big concern that most people have is, how will we know that things aren't going well?
Well, the first thing that you can expect, so brace yourself. The first thing that you can expect is that the number of cases will increase. That was never, ever anything other than the plan. The idea that we could protect the population from this was never, ever part of flattening the curve. Flattening the curve meant extending the duration so that we never exceeded our healthcare capability. So as soon as people start going back to work in Texas and elsewhere, we are going to see a rise in new infections. And when that happens, expect the media to go absolutely ballistic and out of their minds. Now, the question is, what should we be looking for in terms of something to maybe slow this process down? The number of infections will increase. It has to increase. That's the entire goal, really, is this term's been so badly overused, but herd immunity, the idea that enough people have got antibodies, have acquired the COVID-19 virus in one way or another, survived it, and are now, at least temporarily anyway, immune. And so herd immunity means that enough people out there have got it and recovered from it so that the virus no longer can make the jump between people. It's too rough for it. So we can't get to that point unless more people get infected. And so when any state begins to release the social quarantines, expect the case numbers to go up, because that's what they're supposed to do. The entire success of it, and no matter what you may think, and if you've been watching any of this, I do not have a high opinion of our press's coverage of this, nor many of our politicians. But with that said, it seems to be that in many cases, the curve is so flattened that hospitals are sending doctors home or furloughing nurses. So what we've got to do is we've got to make sure that as we begin to loosen these constraints, we don't get a second spike that is sharp enough to go through the limit of our healthcare capability, but there will be a second bump. There's no question about it. And if you are not expecting that, then you don't understand this idea of flattening the curve. And I assure you that the news media will be on top of every single case of new infections in Texas. They'll be absolutely shrieking about how the case numbers are going up again. But that was always the understanding. And now we're going to get a chance to see how steep it is. And I don't think it's going to be too steep at all.
Well, Bill, this is why exactly I asked this question, because frankly, commentators from you to many others, especially on the right side of the political aisle, have been saying now for weeks, if not months, that we can't trust or believe what the mainstream media is saying, what some of the governors of our states are saying, even what some of the medical experts are saying. Everybody's been bought off. Everybody's had a plan from the very beginning. People are trying to bring down our form of government. People are trying to destroy our economy. This is China's way of invading us. And so all of this is out there. You know, unfortunately, I went against the advice of my elders and I read the comments, and you see this kind of recurring thread. So as an individual who's concerned about his own health and safety and that of his family and that of his place of business, how will we know from all of this noise whether things are going well or not?
We'll know that they're going well if the number of cases increases at a rate that indicates it's going to stay below the ability of our healthcare system to manage it and the other cases that it has.
So what's the indicator we look at to determine that?
Available hospital rooms.
And so how does the average person know what the available hospital rooms are at any given locality or state?
If you do not see photographs or video of people that you know in present, when I say people you know, I mean Texans and not Italians or Chinese. If you don't see people in the hallways, if you don't see lines of cars at the emergency room, if you don't have video evidence that the hospital is being overwhelmed, then you know that we're doing just fine. And this is what has been missing, as I pointed out before, this is what has been missing. If this situation had saturated our medical facilities, and it came close in New York. There was really scary in New York for a while. But if there had ever been a case where there were gurneys in the hallway of any emergency room in the country because there was no room to treat them, if there were lines of ambulances, or if anyone had been told, we just can't treat you, you're too old, if any of that had happened, I assure you, we would have seen nothing else but that on the news for the last 6 weeks. And the fact that you didn't see it on the news, the fact that the news media has to use footage from Italy or China in order to break up their narration, is an indication of just how well we've done in terms of flattening this curve and saving American lives.
So I have two related questions to that. Number one is, I think if things are going well, I think people will have a general sense of that. But there's always, the virus doesn't just go away. So how do we resist the tendency to whistle past the graveyard, so to speak, over enthusiasm and say, hey, things are going great, let's get out there and go back to the way things have always been?
There are many people who, through no fault of their own, but exclusively through the miserable coverage of this on the part of our news media, have assumed that social quarantine was something that you did, like you went into the basement until the tornado passed, and then you came back out again. That's not it. That was never it. It was never a case of everybody just hunker down until it goes away. It's never going to go away. It's a gift from the Chinese Communist Party to the human race for the rest of time. This virus will be killing people forever. It's going to be blended in with the other viruses that we have to deal with, and presumably in the not too distant future we'll have a vaccine against it, but it is never going to go away. It's here forever now. So the question that you're asking is, how will we know that we've got this under control? Well, first of all, we have to understand that there will be excess deaths due to COVID-19 this year and every year from now on, not just here, but all around the world. That is the fact of the matter, and that has never been any different from the moment it got out of Wuhan. It was a question of how badly are we going to be hit by this thing, not if and not when is it going to be over, because it's never going to be over. I hate to be the person to tell you this. The news media should have told you this from the beginning, but this is the facts of the case and nobody denies it. This is not going away. So the answer to your question will be this. Will we be able to maintain, if you take New York, which has not only unique problems, but also unique, when I say political problems, they were saying, oh, go to Chinatown, have a blast, real late into this. If you take New York out of the national numbers, including other big cities, just take New York out of it, we have done by far better than any other country in the world, better than Germany even. So what we want to do is we want to make sure that as more and more people get exposed to this, there will be more cases of people contracting the disease. The number of cases will increase. This is not a failure. This is expected. I can't stress this more, strongly enough. Of course, the number of cases will increase. What we need to do, our metric for how successful we are, will be, can we keep it below saturation levels, which means that are hospitals anywhere ever getting to the point where it looks like they no longer have the capacity to deal with this and have to offload it to other facilities.
Well, and I think I lost track of the question here because, Bill, I'm not specifically saying, like, how will we know it's going well? I think that people will have a genuine sense or general sense that it is going well, and then perhaps run the risk of over enthusiasm and saying, hey, things are going great. We don't have to worry about it anymore. Ditch the masks, ditch the social distancing. Let's go shake hands. Let's get out there in public. This is no worse than the seasonal flu. And we already have those memes going on right now in social media and elsewhere where people think that this was always overblown. And now
it wasn't.
Americans are generally an optimistic people and a hopeful people and a forward-looking people. And so I guess I wonder, how do you rein that pony in? And, sort of like Mel Gibson in the William Wallace movie where he's going, hold.
It's a great analogy, actually. Let's put it this way, no matter what your individual opinion of the severity of this, the threat of this, whatever, I think we can all agree that there's not a whole lot of people who can claim that they're unaware of the COVID-19 virus. I think that's probably at this point pretty well established in people's consciousness. It's not a question of us, hey, we forgot to mention. So we're going to be looking at this, and the press is going to be leaping on any opportunity to show that people went back too early because of the political orientation that the press has. But for regular people, we will know that we're in trouble if the reinfection rate, if the curve of the reinfection rate looks as steep as it did before, if it looks like it's going to burst through the flat line of our ability to handle this in terms of medical rooms, then we'll have to back off. And the president's plan is predicated on that. I think it's an exceptionally wise plan. But let me say this: I fully expect to be shaking hands and going to movies by the 4th of July at the latest. And I expect that the country will be going back to work much, much, much sooner than that. So what's going to happen is this virus is going to look, the virus is not changing, at least not significantly. So all that we're struggling with now is, what is the effect of this virus on the world society going forward? It is a new way to die. And it joins all the other ways to die that we have. And this is the kind of talk that no one is having. And no one is having this kind of conversation. There is a new way to die now called COVID-19. The good news is there's a lot of ways to die that are no longer with us, like smallpox and yellow fever. And those bar graphs are far higher than the one that we've just added. But you have to understand this. It's beginning to look like if we can maintain the same mortality rate that we're seeing outside of New York City, then this will be probably about the same as a severe flu season, but we didn't know that in advance. That's if you take New York out of it. If the rest of the country starts to develop New York style infection rates and contagion rates, then we're in a whole different ballgame. But let's not forget that the low end number was 2 million at the beginning of this, and the initial forecast, well, it was maybe the mean or the high number. But then it was revised down to 200,000. And now it's looking like it's going to be probably 60, 70, 80,000. That's a lot of dead people. But one of the problems that we're having with this is that we do not and have not established an ironclad, legally binding protocol for determining what a COVID-19 death is. If you test positive of COVID-19 and die of a heart attack, there's anecdotal stories saying that it's pressure to put that down as a COVID-19 death. And that's just plain lying and deceit and panic mongering. But to the people who say, no, it's just a regular flu, you tell that to the guys who were working in the emergency rooms in New York City, who had been emergency room doctors and EMTs and nurses for 30 years, and who stared at each other in the end of March and the beginning of April saying, my God, it is the apocalypse. That is firsthand evidence that's not based on models. And so what I think we should be doing is we should be saying to ourselves, look, if we have emergency rooms that are laying off people anywhere in the country, because we've handled this so well in terms of the social quarantining, then for God's sake, let's go back to work carefully, exactly the way that they're doing in your store. Your store is a perfect example. We couldn't ask for a better example. You're going back to what, 25% capacity of the store?
Yes, that's the governor's order.
All right, so that's reasonable. So somebody's going back to work, you can buy furniture again. And then you're going to figure that within 4 or 5 days, we're going to start seeing new cases of infections from people who have been quarantined, but not nearly what we were seeing before because the chain of infection has largely been broken. The number of cases will go up. And then if it looks like they're going up at a relatively flat rate, a manageable rate, then they'll go to 50% capacity. Then they'll go to 75, and then they'll go to 100.
But let's say that doesn't happen. Let's say that it actually turns out to be too much too soon. The cases spike again. The death rate spikes again. Can you envision the possibility of governors or the president or local authorities saying, okay, back to your houses? Like, how do we get that string back on the yarn ball there?
Well, we do have some data that answers that question, and it's like every other question that any president has to face. Unless you're pardoning a turkey or something, your choices are bad or worse choices. So we need to understand that this economy has taken all that it can take, and probably more than it can take. And if it turns out that this a reinfection wave is extremely severe, I don't think people are going to go back to self-quarantine. But on the other hand, Scott, I also think that people are not going to immediately go back to handshakes and kissing people on the cheek and so on. I think most people are going to continue to wear masks out in supermarkets for a while until it's clear that it's not. They're going to do it out of their own personal concern for their own safety and their own family safety, not because of what some bureaucrat says someplace. And so we will simply watch and do what we've done so far, which is adapt to it. And the American people's adaptation to this pandemic is orders of magnitude above what the press and many politicians have been doing. I've been totally impressed, absolutely amazed, not surprised, but amazed at the wisdom of the American people as a general rule in terms of dealing with this thing that we have never seen before, at least not living Americans have seen before. And to answer your question directly, if those numbers go up again, then we're going to have to face the fact that this is going to be a more fatal disease than we thought it was going to be. But we cannot look. It is not a question of protecting people as if shutting things down had no consequences. That's just not an option. And for people who say that it is, like Bill Gates, who'd say, well, we may need to self-isolate until July of 2021. No, Bill, no. It's easy to say that when you have $80 billion. And if you look carefully, Scott, one of the things you're going to find is that the people who are talking about indefinite shutdowns put their politics out of it. But you'll find that virtually everybody who's in favor of this are people who are very, very capable of surviving indefinite shutdowns. And the people who want to go back to work are the people who have to go back to work. And they're going to take precautions for their own lives and their own families, and we're going to be just fine. But it is a new form of death. And we can thank the Chinese Communist Party for this. It's here forever. It will never go away. It will perhaps, when a vaccine is available, we might be able to mitigate it to the point where it's essentially an anomaly. If the virus stays more or less stable and we can get a vaccine for it, then if you take your vaccination shots, then it will be something just like smallpox or yellow fever or any of these other diseases that we have completely under control in this country. That's the answer.
Go ahead.
No, that's the answer. That's it. There's no good news here, but I do think that that the best possible of all the bad news is to look at the fact that at least by now we have saved tens of thousands, if not hundreds of thousands of American lives by doing this. And every single day that goes by, as more and more people are tested, we find more and more people are tested positive and they're asymptomatic. That's great. If one person dies and you've got 10 people tested, you have a 10% mortality rate. If one person dies and you test 100 people and they're all positive, you have a 1% mortality rate. So the number of people dying is constant. The more people that we find who test positive means that every time we expand the base, the number of people that die means the mortality rate goes down and down and down and down and down. So that's the good news. And we're also learned some tough lessons, really tough lessons, in terms of things like ventilators. We all thought that the ventilators were going to be the difference between life and death. No. The survival rate for people who have to go on ventilators is 20% or something like that. So let's do what we're doing now. And for God's sakes, let's keep the regulations out of the way. I think the most important thing that President Trump has done by far, two things. He's brought the power of the private sector into this in terms of having people who manufactured automobiles now manufacture masks, and the same thing for guys that make pillows. And the second thing that he's done is he has been absolutely draconian in his willingness to tell the people who want things like double-blind tests and all the rest of the scientific stuff that needs to be there for scientific rigor. But he's basically said to these people, we're not going to experiment on American lives. If this shows some promise and the side effects are reasonable, then if people then advise them of the treatment and let's save lives and worry about the tests later. If somebody is dying, if they are in such respiratory distress that they are in danger of dying, I think an adult has a right to make a decision and say, would you like to try this drug that has had a remarkable degree of success with other people, but has not passed strict scientific rigorous controls in terms of its efficacy or its safety? If I'm struggling for breath, I'm going to say, yeah, I'll take it. I'll give it a try. And this is what the people who run our lives can't bear. They cannot bear the fact that an individual human American could make a decision contrary to what the Food and Drug Administration has advised, because if they can, it starts you leaving with other questions like, well, maybe the president handled this well, or maybe the Food and Drug Administration, which does provide the essential service of making sure that the food at the supermarket we eat is safe to eat, maybe they're a little overregulated. And that's not something that they're particularly eager to have the American people discover either.
Well, while much of America is getting back to business, the members at BillWhittle.com know that we've actually ramped up production during this time of pandemic, when everybody had to stay at home. And we've only been able to do that because of the faithful members at BillWhittle.com who have continued to contribute. And in fact, their numbers have grown. I was just looking this morning at the track record of the last year or so, and these last 2 months have been the strongest growth period in nearly a year for membership at BillWhittle.com. We appreciate the way our members value this kind of content and their role as producers and distributors of it. If you've not yet become a member at BillWhittle.com, we invite you to go to BillWhittle.com and click that Become a Member link. We're also grateful for our friends at the Patriot Post, who are offering you a free copy of their Patriots Primer on American Liberty when you sign up for their email list. I'll provide a link in the description below for that. For Bill Whittle, I'm Scott Ott. Thanks for watching.